Hello, Assalamu alaikum, and very good morning from Lahore. I'm Dr. Javed Iqbal Khokhar, Professor of Forensic Medicine and Toxicology, and I'm starting with the new topic, autopsy. And this is the first lecture on this topic. And the learning objective of this lecture will be that I will be discussing in this lecture what is autopsy. And there are also the synonymous words, necropsy and post-mortem examination. And what does this mean? I'll discuss. Then what are various types of autopsies? They are the medical autopsy, medico-legal autopsy, psychological autopsy, mini autopsy, and virtual autopsy. So the contents of my talk will be that I will be discussing about what is autopsy and what are the types of autopsy. This will be the core topic of my discussion. Autopsy means complete examination of dead body, both external and internal contents after opening the cavities. And it also includes the materials which is going to be collected for various labs, that is histopathological, biochemical, or toxicological examinations. There are two synonymous words they are commonly used: necropsy and post-mortem examination. Necropsy means dead, so it means the examination of dead. Whereas recently the term autopsy is used for human bodies and necropsy is used for animals or any other inanimate things. Post-mortem examination is examination after death. And it should be kept in mind that in USA and some other countries, autopsy and post-mortem examination, they are two different procedures. Post-mortem examination in USA, it only include external examination of the body without cutting it. However, the collection of specimens like fluid specimens, they can be collected, urine or blood, with the help of needle. Now, regarding the types of autopsies. The types of autopsies may be classified as such that it can be physical autopsy, which can be medical and medico-legal, psychological autopsy, and virtual autopsy. Then we can further elaborate regarding the physical autopsy. It can be medical autopsy, medico-legal autopsy, mini autopsy. These are types of physical autopsies. The medical or hospital autopsy, they are conducted on natural deaths occurring within the hospital, and they are conducted by the physicians or the pathologists to establish the medical cause of death, and especially in those cases where the clinical investigations during the life of the patient remained futile in establishing the disease or process of the efficacy of the therapy. Whereas the medico-legal autopsy, it is the autopsy on all unnatural deaths. And it's a complete scientific study of the dead body, both externally as well as internally, to establish the cause and manner of death under the law of state for protection of society and administration of justice. Regarding the psychological autopsy, it is an investigation along with physical autopsy of the dead body. Psychological autopsy is performed in those cases where there is alleged allegation of suicide, and we want to know about the mental status of the deceased at the time of death and information about the background of the person it is collected. Now, regarding the mini autopsy, this is the term for a type of partial autopsy in which there is extensive organ sampling but not complete opening of the cavities. and organ removal through a limited incision, and it can be up to 15 centimeter in the upper abdomen, and from there you can collect the organs. Now regarding the virtual autopsy, this is also known as autopsy, and this is a post-mortem examination without compromising the integrity of the body. That means the autopsy without cutting, even without collection of the samples. And in this, all the radiological examinations can be performed, like X-rays, ultrasound, MRI, and CT scan. There is another way of classifying that autopsy can be negative autopsy or it can be a positive autopsy. The negative autopsy means where the cause of death cannot be certain besides all the efforts, and those efforts mean dissection, analytical examination, histopathological examination, and all other aided examinations fail to reveal the cause of death. Then the autopsy is negative. About the positive autopsy, where you can definitely conclude, or a definitive conclusion about the cause of death can be drawn. So the summary of this lecture is that I have discussed about the autopsy, what is autopsy, and the synonymous word necropsy and post-mortem examination. What are various types of autopsies? They are medical autopsy, medico-legal autopsy, psychological autopsy, mini autopsy. They are the most important. Then virtual autopsy. Thank you very much. Take care. Allah Hafiz. Please subscribe to my channel, and this is my channel name, Dr. Javed Iqbal Khokhar.